Get more and more opportunities in this new environment and human infection to mutate and change and to have a widespread impact.
I'm a disease ecologist and epidemiologist, and my nightmare outbreak scenario actually happened. I got to live it last year. Sierra Leone and Liberia are just recovering from some very brutal civil wars. 85% of the health clinics in Sierra Leone were destroyed during the Civil War. And West Africa has a very high population density. They have some very good roads. So if you take a health system that's in shambles and you add an Ebola outbreak and a rapidly moving population, then you have the perfect storm.
When the outbreak hit Sierra Leone, Kenema Government Hospital was really the only hospital that was prepared to deal with patients with hemorrhagic fever. And Kenema was extraordinary and prepared for 1 or 2 or 3 cases, but before you knew it, there were hundreds. And at a certain point, everybody has their threshold, and they were overwhelmed. And what happened was one of the nurses became infected, and then that spread through the clinical staff.
One of the tragedies of Ebola is that it spreads through love and through people taking care of people that they care about.
In this outbreak, we have 11,000 deaths. But what's really shocking is that 800 of those deaths are healthcare workers. It's estimated there was a 20-fold increased risk of a healthcare worker. My team also lost a number of our clinical care workers. All clinicians, all healthcare workers, all loved ones of individuals who are sick are putting themselves at risk every time they go to care for somebody who's ill like this. The Ebola outbreak we saw in West Africa was by far the largest outbreak we've ever seen of Ebola. And so this is, as opposed to small numbers of cases, you're giving the virus many opportunities to replicate and to pass from human to human. And each of those is an opportunity for an accidental mutation to allow it to adapt. And there is new evidence. There was a mutation that occurred early in the outbreak, a few months into the outbreak, that changed one of the important genes of the Ebola genome. And that mutation likely not only increased infectivity, but did so in a way that was more specific to humans and primates. But the story to be told is not one that is answered by genomics, it's just answered by faster response. The more time you give it to change, the more chance it will.
I do think that the world is not prepared for a long and sustained disease pandemic. The main reason why is because you see such disparities in health, quality of health. It's no accident that the epidemic happened the way it did in Sierra Leone. If Sierra Leone had the health system and the health infrastructure that we had in the US, you would have seen 2 cases like we saw in the US instead of the thousands and thousands of cases that we saw here. As long as there are countries that do not have proper health systems, everyone in the world is vulnerable.